Hi, our lecture is about assessing patient. This is part of a series of lectures. This is just the first part of it. We'll go through the biographic data and history taking, and then we go as part of the clinical examination. Why would we assess our patient? We assess our patient to provide safe and accurate treatment for our patients. Requirements for successful patient assessments need to be tailored, so it needs to be specific. The question we ask needs to be targeted for that patient. I wouldn't deliver questions for a pediatric patient as same as I would direct a question for an adult patient. This needs to be systematic, so we have certain points and we need to follow them point by point accurately, and this is what we call systematic, just to avoid missing anything in between. The question we need to place need to be opened rather than closed. Okay, an open question, for example, if we ask the patients about how is your general health, this is an open question and will open the patients to many answers. But a closed question would be like, for example, do you have hypertension? The patient would simply answer with yes or no, but he might have something serious else rather than hypertension. Okay, so the question needs to be opened rather than closed. We don't paraphrase what the patient said. So whatever the patient said needs to be written as the patient said it on your record. Do not lead the patients whenever possible. We avoid leading the patient. The process of assessment is either by take many categories. We go to them, as we said, systematically, part by part. Part of it is the biographic data, and then the next part would be the chief complaint. We have the history of present illness. The biographic data is general information about the patient. Chief complaint, what brings the patients to our clinic. The history of present illness or the history of the chief complaint is a detailed description for the chief complaint. We have the past dental history, the patient's previous experience with dentistry, the medical history, social and family histories, and of course, no assessment without examination. So we have another part which is really important, the extra and intraoral examination. Laboratory and imaging results need also to be taken if needed. So if we need, we might consider referring the patient for investigation, laboratory investigation or radiographic investigation. So we ask for images, radiographic images. Biographic data. This is the first part to be taken, and it includes the name, age, gender, occupation, and the phone number. Why would we include this in our assessment? Because we want to consider a patient as a human being rather than a collection of signs and symptoms. The name is really important to address the patient by their name, and the age will give you a hint about the general well-being of the patient. Gender, male or female. The occupation, there is certain diseases that related to the occupation, work-related illnesses, and the phone number. It's really important to have a phone number either now or later on in your uh, assessment. Phone number is important to give the patients, to schedule patient for treatment, to give an appointment, I mean, or to change an appointment, or to check on the patient following the delivery of the dental treatment, whether there is a complication or not. The chief complaint, this is what brings the patients to our clinic. It is, as we said, a chief complaint, so it could be a main complaint, or the patient might have a list of complaints, beginning with the most important one, which is the chief complaint. And then the next part is would be the history of the chief complaint or history of the present illness, which is the detailed description about the patient needs, patient's complaint. For example, if we have, for example, the patient present with pain, the chief complaint would be pain. And the history of pain would be the history of the chief complaint. It would be the history of pain. History of pain could be, for example, characteristic of pain, throbbing, electrical shock, shock, whatever the patient experienced need to be written in your record as the patient said it. The severity. The severity of the pain could be either mild, moderate, or even severe. Having said that, we usually ask the patient about the severity of pain. Other way to do it is to give the patient, for example, on a scale from 1 to 10, being 1 is the least pain you have ever experienced, while 10 is the most severe pain you have experienced. How you find your pain. Okay, and the patient would answer, for example, 1, 2, 3, whatever. You write 5. For example, on the scale from 1 to 10, patient selected 5. Okay, or you can do it like mild, moderate, severe. A date of onset, when the pain starts. Is it 2 weeks ago, 1 year ago, 3 days ago, last night? Whatsoever, when the pain starts, you need to make a record about it. The duration, on the other hand, how long the pain episode lasts. Is it last for seconds? Is it can last for minutes or even hours? Whatsoever, you make note about it. The location of the pain, what the pain is about. Is it upper, lower, right, left, whatsoever, you write on it. At this point, we prefer to ask the patient about the pain location in quadrants rather than having a target tooth, because we haven't done the intraoral examination yet. So we don't record, for example, pain in an upper central incisor. We just write pain in the interior, pain in the posterior, posterior right, posterior left, okay, upper, lower, and so on, okay, just in quadrants rather than a target tooth. Spread of pain, is it a localized, radiated, or referred pain? The spread of pain, for example, if it is a target tooth, so the patient would say, no, I just feel the pain here, just around this tooth, so it is a localized pain. For example, sometimes the patient would say, no, I would feel it here, and then it would go and affect the other teeth on the same side. So this is radiated. There's a target tooth and radiated to the same dentition. And sometimes we have a referred pain, means the pain is absent from a target area and then moves to be presented on somewhere else. This is a referred pain. An aggravating factor, what makes the pain become worse? Is it cold, hot, mastication? Whatsoever the patients can present as an aggravating factor. For example, sometimes the patient would say, when I take sweets, okay, the patient comes. So sweets will be an aggravating factor. Thermal changes like hot, cold, if it makes the pain goes worse, then it is an aggravating factor. Relieving factor, what the patient would do to make the pain go away. Is it a medication, brushing, okay? A relieving factor should be recorded. For example, patient takes paracetamol as analgesics to make the pain goes away. So this is a relieving factor. Any associated sign and symptom, for example, if the pain comes with fever, the patient says, I have a pain and also I have a fever. So fever is associated with the pain. So fever is associated sign and symptom. Swelling, discharge, sleep disturbance, all of this are considered as an associated sign and symptom. If the patient comes with pain associated with any of these, you need also to make detailed description for these as well. Past dental history, the patient's previous experience with dentistry. For example, patient had previous extractions, previous restorations, previous scaling and polishing, previous bleaching, whatsoever, previous prosthetic treatment. Any previous treatment, you need to make note about it. For example, as we have just said, previous extraction without complication. And if there is any complication, you also need to make note about it. For example, previous extraction with bleeding, previous extraction with infection. We need to establish why the patients had bleeding, why the patients had previous infections, Okay, is the patient has bleeding problem? Is the patient on certain medication that cause that bleeding? Medical history. Why this section is important? Because medical history would affect also the well-being of the oral cavity. Certain medical diseases or disorders can have presentation within the oral cavity. Certain diseases, patient would take medication that would affect the well-being of the oral cavity, or sometimes the certain this diseases or medication might affect the delivery of your treatment. For example, if the patient is hypertensive, okay, we need to avoid certain medication we give. If the patient have an aspirin taken as a prophylactic measures to prevent thromboembolic event, we might consider referring a patient for investigation or taking extra precaution to avoid bleeding following the extraction. Okay, in important sections to be reviewed: cardiovascular system, respiratory system. The patient have an asthma, for example, central nervous system, epilepsy, allergy. For example, if the patient is allergic to penicillin, reasonably we would avoid giving penicillin to patients who are allergic to it. Okay. Current medical treatment. If the patients are on medical treatment, why is that? What type of medication the patient is taking? Drug history. There are certain interactions between medication we give in dental practice, for example, metronidazole and warfarin. Metronidazole potentiate the effect of warfarin. Warfarin causes bleeding, and metronidazole potentiate this side effect. So taking the drug history is really important as part of the patient assessment. Using antithrombotic medication, as we have just said earlier with aspirin, lifelong side effect of IV phosphonate. Biphosphonate are taken for patients with osteoporosis or female patient with breast cancer. It has a long side effect which affect the jaws. It can, if the patient has infections or extractions, it might cause osteonecrosis of the jaw. So this is a lifelong side effect. Patients on IV biphosphonate might need to be referred, even for simple extraction, need to be referred for hospital setting for the planning of the extraction. Previous hospitalization, if the patient have been admitted previously to hospital, why is that? You need to establish it and know the time of it and the reason for it. Bleeding disorder, if there is, for example, patients on hemophilia, okay, you need to make note about it. History of infectious disease, tuberculosis, hepatitis, or HIV, you also need to take note about it and take extra precaution if the patient had one of these. Pregnancy and breastfeeding. Pregnancy can affect the timing for the delivery of the dental treatment and the medication we able to give. Breastfeeding affects the medication we give for the nursing mother, because eventually the medication will be absorbed and then redistributed through the milk to the nursing baby. All of this is really important and really related to what we do in the dental practice. So every single section needs to be taken seriously. Social and family histories. We ask the patients about the marital status, occupation, smoking status, alcohol consumption, and any familial disease. Marital status, for example, if the patient is being married or not, single, married, divorced, whatsoever. Occupation, as we said, there are certain illnesses related to work. Um, Smoking status, if the patient smokes, what type of smoking? Is it cigarette smoking, water pipe smoking, electrical cigarette smoking? All of these needs to be established and you make note about it. How much the patient smokes? Is it one pack, one cigarette per day? Okay, patient who smokes, they need to consider with smoking prior to extractions. Patient who smokes might alter the treatment plan we give in the dental practice. For example, if the patient needs dental implants and the patient smokes a lot, there is a risk for failure rate higher in smoker patient than non-smoker. So the patients need to know about that. If the patient smokes a lot, needs to quit smoking following extraction for at least few hours just to allow the clots to form and prevent infections. Any familial disease, alcohol consumption. Taking alcohol wouldn't interfere with the dental treatment, but abuse of alcohol, taking too much alcohol might damage the liver, and then the side effect of liver damage become apparent. For example, the liver is responsible for the synthesis of a clotting factor. Taking too much alcohol will damage the liver, and no longer the patient will able to synthesize a clotting factor, so bleeding might become evident following extractions. Alcohol consumption might, as we said, damage the liver, and the liver is the site for drug metabolism. So having a damaged liver will not be able to metabolize the medication, okay, will increase their side effect, and their drugs intoxicity might become apparent. Any familial disease, for example, hemophilia, these diseases, hemophilia and sickle cell anemia, has mode of inheritance, being from parents to children. So patients need to taken for any familial for any diseases that runs through the family. Starting with the extraoral examination. Extraoral examination as part of the patient assessment. We have extraoral examination and intraoral. In this slides, we will discuss part of the extraoral examination. The extraoral examination is a physical examination, and it can include inspection, palpation, auscultation, and percussion. Okay, as a general rule, for any examination, we start with the eye first, and then we use our hands. So inspection with the eye, and then we go with the palpation, auscultation, and percussion. The first part of the extraoral examination would be the examination of the temporomandibular joint. Temporomandibular joint, okay, in its examination, we examine the joint itself, and then we also examine the muscles associated with that joint. The examination of the joint, as we said, start with the inspection. So using the eye first, then using our hands. The inspection, we inspect the range of the movements, the maximum mouth opening, and the lateral excrusions. The maximum mouth opening, as you can see here within the ruler, is measuring it between the two opposing incisal edges. It's about from 35 millimeters up to 40. And we also measure the lateral excrusions. So we measure the distance after we ask the patient to do lateral excrusion. We measure the distance between two deviations of the opposing midlines. We use a ruler to measure the distance between the upper midline and the lower midline. It is usually about 10 millimeters. We also inspect the direction of opening. We ask the patient to open and close and move. As the mandible moves, we see the direction of opening. Usually it is a straight line without any deviation. This is the normal opening. And if there is adhesion on one side of the joint, there will be an oblique line directed toward the affected side. We also have a straight line with lasting deviation, as you see here in this schematic diagram. A straight line with lasting deviation is for a temporomandibular disorder that is called a disc displacement without reduction. And if we have a straight line with a transient deviation and then the mandible goes into a straight line, this is a disc displacement with reduction. It's also a temporomandibular disorder. Having said that, we go from the inspection and then we start using our hands by doing palpation. We palpate over the joint just in front of the external auditory meatus and ask the patient to open and close. If there is any pain, tenderness, we make note about it. Intra-auricular palpation by using the little finger within the external auditory meatus with an anterior pressure. Okay? We ask the patient also to open and close, and if there is any pain that is felt during the examination, we make note about it. Auscultation means using a stethoscope to hear if there is any sound within the joint. And the sound can be sometimes well audible. You don't need a stethoscope to hear it. We call it a click. Okay, and this is associated usually with a disc displacement with a reduction. Sometimes it is a crepitation. A crepitation means a soft sound that you need a stethoscope, and it reflects a degenerative disease within the joint, usually associated with rheumatoid arthritis. Having completed examination of the joint, we need to examine the muscle that is associated with that joint. We can either do a direct palpation over the muscles. For example, this would include the masseter muscle and the temporalis muscle. Or sometimes it is indirect palpation, that is indirect examination. For this would include the lateral pterygoid. Direct examination of the masseter starts from its origin up to its insertion. The origin from the anterior two-thirds of the zygomatic arch, and it's inserted to the angle of the mandible. So we place our fingers and ask the patient to clench. Since the masseter is responsible for the closing of the mouth, so we ask the patient to close their mouth and to clench strongly and assess the muscle for any tenderness. If there is any spasm, we should make note about it. While for the temporalis, the origin is at the temporal bone, so we place our finger and ask the patient to clench because the muscle is also responsible for closing the joint. And then we examine intraorally for the insertion of the temporalis muscle. We run the index finger on the external oblique ridge up to the ascending ramus to the coronoid process where the temporalis muscle is inserted. And if there is any pain, these need to be taken as a note within your files. Indirect examination, this would involve the lateral pterygoid. We ask the patient to open against resistance because the lateral pterygoid is the muscle that is responsible for opening of the temporomandibular joint. We ask the patient to open their joint against resistance. So we place our hands beneath the chin and ask the patient to open. If there is any pain, we should make note about it. Lateral excrusions is also the responsibility of the lateral pterygoid. So we place our hands against the chin and ask the patient to do lateral excrusion, okay, against the resistance of the operator hand. And if there is any pain, we need to make note about it. Okay, that is all what we have for today for the examination of the temporomandibular joint and the general information we take it prior for the examination. If you have any question, please feel free to place it on the comments. I will try to do my best to answer them. Thank you.